On behalf of ICN, it is my pleasure to bring you greetings for the International Nurses Day of 2015. The theme that ICN has chosen for this year is Nurses, a Force for Health, Care Effective and Cost Effective. Again, Nurses, a Force for Health, Care Effective and Cost Effective. The slogan reflects ICN's commitment for action to strengthen and improve health systems around the world. It also leverages the contribution that nurses can make and acknowledge that as a profession, we reach people that other practitioners never see, both in urban and rural and remote communities. There are over 16 million of us, and most places in the world that you will go, you will find a nurse who does effective care. In short, global health cannot be achieved without nurses and without our proactive contribution and participation at all levels of the healthcare system. And if you look at a lot of the global discussions today, it is very clear that economic prosperity will not be achieved without health, and health will never be achieved without nurses. We know that the cost of healthcare is rising worldwide, driven by a combination of the growing burden of non-communicable diseases, aging societies, more expensive treatments and techniques, and increasing demands of clients. Nurses, as the single largest component of the health workforce, are very well positioned to make the best use of available resources, to do more with less while providing quality care and optimal patient outcome that usually is evidence-based and always quality care. It is with this in mind that ICN developed the vital toolkit for nurses to help them develop a proper understanding of healthcare financing, budgeting, resources, allocation, and strategic planning. Everywhere I turn in my touring around the world, people talk about the cost. So it's important for us as nurses to be able to talk about healthcare financing, understand the issues, but also to tell the story how nurses are cost effective and care effective, and how we achieve excellent outcomes for our patients and communities. We also have to look at the future and the key contribution that nurses can make to the international agreed objectives of universal health coverage as a means to achieving better health outcome for all people. And again, universal health coverage is one of the currently globally thrown around term everywhere. It means, in one hand, to try to alleviate the poorest of the poor from their level of poverty and bring them to a healthier lifestyle. And again, by being healthy, they will be able to be productive. Nurses can help them to do it. It also means that we would like to see people have equitable access to basic health care. Universal health coverage aims to ensure that all people can use health services that are of sufficient quality, while at the same time ensuring that the use of these services does not cause financial hardship to consumers. We all have seen the impact of private healthcare that often causes significant financial burden on individuals and families. Universal health coverage aims to try to avoid disastrous financial impact on families and communities. There is no doubt that we face many challenges in achieving cost-effective healthcare. The global nursing workforce shortage and the lack of investment in nursing have had a detrimental effect on patient care, as well as the nurses' working condition and pay. And we increasingly seeing in countries where there is nursing unemployment, but at the same time, patients do not get the care that they need because of the lack of healthcare financing. ICN believes that it is nurses, as patients' advocate, that are ideally placed to make major contribution to shaping health policy, that it's underpinned by equity and cost effectiveness. And our voice around that policy agenda of saying equity can be achieved by good policies and cost-effective care is what nurses advocate for. The question is how we do it. The IND kit lays out the principal models of financing healthcare and the efficient use of resources and the major causes of inefficiencies. And each and every one of you who watch this video probably can generate a significant list of inefficiencies in the system. How are we going to stop it? How are we going to make sure that the care is cost effective and clinically effective? How are we going to make sure that the funds that are available are used for the right reasons and there are enough resources to invest in nursing care? The toolkit really clearly identifies ways in which nurses can improve health system efficiency and become more cost effective and care effective through access to the latest synthesis of evidence and the necessary skills to pursue quality and cost-effective change. The toolkit and the document is a very powerful one. I strongly recommend that you both download it and look at it from time to time as you talk to different groups of people. With this IND toolkit, ICN has launched a call for action for nurses and nursing associations to mobilize individually and collectively to tackle health system financing and achieve quality of care and patient safety in a cost-effective way. We have to educate our governments, our healthcare leaders, our healthcare executives about the policies and the financing that needs to be in place to have care-effective and cost-effective care. NNAs have a tremendous opportunity to advocate and reinforce the critical role of nurses in the development of quality health policy and the effective and efficient redesign of health system that increases access and deliver effective health interventions. NNAs in the countries and other nursing organizations, so national nursing associations, together or in partnership with other nursing organizations, have an obligation and responsibility to communicate these messages. We as individual nurses also have to be active, but organized nursing has an absolute responsibility to do so. I encourage you all to read this year's IND kit and discover the ways in which you as an individual nurse and the National Association can be more care effective and cost effective. If we all, the 16 million of us, do our share in promoting and explaining why nurses are absolutely essential, whether it's for universal health coverage or non-communicable diseases or emerging or existing infectious diseases, and the list goes on and on and on, and educate decision makers why investing in nursing is cost effective and care effective, the health of the people in this world will be better than it is today. So have an amazing International Nurses Day, and let's get busy educating policymakers about the impact that nurses can make to the system. Thank you.